The next speaker I would like to invite who will share the vision of APPS with us, Dr. Abdul Hafeez, Consultant General Practitioner, Founder and Chairman.
Assalamu alaikum. I was planning to present the vision of APPS UK in front of you. However, at the last moment, they've asked me to sing a song. So please bear with me. It is a great privilege to speak to such a wonderful audience all together under one roof. Just imagine what is being projected in the media in terms of what Pakistanis are. And I would present this crowd to all the media, successful people having fantastic work day in, day out within the NHS. And we are really proud of that. There are 12,000 Pakistani doctors registered with General Medical Council. This also includes the students in British universities, obviously of Pakistani heritage. And there are so many success stories, and that really made APPS UK proud. At the same time, there are a number of issues which we are aware of. For example, when we look at the data of fitness to practice hearings, how many BME doctors are represented and being punished? There is a huge mismatch compared to when compare with the local population. And as well, if we look at the GMC register, 20% of the total register consists of BME doctors. But when we look at the top 22%, for example, the chief executives and medical directors, hardly any Pakistani. So this is something which we really need to focus on in terms of how we can make things better. We know NHS is going through a big crisis at the moment. There is a recruitment drive going on as we speak. And as you may be aware, 300 to 400 doctors are being recruited at the moment from India. And obviously this is what we really need to aim at. And APPS UK has taken up this difficult challenge. A lot of our colleagues are working and doing training seminars. Dr. Shahid Latif, Dr. Sohail Chughtai are doing live programs to train Pakistani doctors in Pakistan so they stand a good chance in terms of being recruited in this country. On the other side, obviously we are not just focused on our issues here, we should also be focusing on what we can do for our country back home. And there are a huge number of projects which we are running in Pakistan. But what I really want to focus on is the huge resource which APPS UK has in terms of clinical skills. We have come from Pakistan, we entered NHS through a difficult loop. We have learned so much, and government can definitely tap into that loop. I'm sure we are very good in developing health systems and projects. I mean, the government should not be just looking at remittances. That's one part, but obviously the human skill and how we can really make a huge difference in terms of improving the health system is what we really are focusing on. I wrote a policy paper in terms of how Pakistan can modernize the health system. Obviously, I don't have time to go through it all, but I'll just give you a few examples so you can see the things which we are really working on. You are aware already the mobile health clinic project, that was our solution, how we can take a doctor who does not want to sit in a rural clinic. We provided him good working environment in a clinic which is very modern. He goes to a village, sees the patient and come back, and he's very happy. Patients are very happy, and this is a huge achievement which we have already done. Another example which I would like to share is medical records. I mean, as you know, in this country, we have a very good system of keeping medical records. In Pakistan, there is hardly any system. If, for example, there are medical records, then patient does not have to go to another doctor and have a CT scan again in another month, which is absolutely waste of resource. We do understand the medical records can't be electronic. However, we can simply give a file to the patient saying This is your medical record. You keep it, bring it back next time. This is important. This is essential for continuity of healthcare. We also propose that, like in this country, we have NHS direct system. There is 111. A doctor sitting anywhere in Pakistan can advise a patient who may be sitting anywhere in Quetta, in a village. Every single person in Pakistan has a mobile these days. So it's very easy to access that service, and also keep that in mind in terms of what overseas Pakistanis can do. We have links with Pakistani organization in Australia, Middle East, UK, America. We can provide 24-hour cover from sitting here. It's just a matter of having that system in place where we can really provide this service and free of charge for Pakistani people. It's just these telephone lines are so cheap these days. I can talk a lot, but I don't think I'm going to continue on this. In the end, I would like all of you to please join APPS UK. If you think you have the passion like our team has and you have plan, please bring your plan forward. We would like to see you in APPS UK Council. Please do speak to me if anyone wants to join and wants to make a difference and be part of this successful team. You can follow us on Facebook. Or Twitter. We have more than 10,000 followers on Facebook. Every single day we are writing medical education, awareness, medical news from all over the country. This is for the public. We have a separate forum, and we also have one for the doctor. In the end, I would like to leave you with this image. Can we have that picture, please? There are state-of-the-art hospitals in big cities. But when we look at the rural areas, things are appalling. And I have been to rural area myself only 2 weeks ago. This poor gentleman is dragging the bed of his wife on a street to save her life to take to hospital. These are the people who APPS wants to really help. And we need your support. Thank you.